Care homes close as visa crackdown fuels staff crisis. Published by iNews. Care homes struggling to find staff following changes to the immigration system that will not be reviewed by the new Labour government. Care homes are preparing for a looming staffing crisis following an 81% plunge in visas issued to overseas workers, with some already forced to shut their doors. The number of health and care worker visas granted fell from 121,290 to 89,095 in the year to June 2024, a decline of more than a quarter, according to the Home Office. Visas issued in the 3 months to June plunged 81% compared with the same period last year, with an accompanying 66% fall in visas issued for dependents. Care homes warned that changes to the immigration system that took effect earlier this year were making it more difficult to recruit and could lead to more providers shutting their doors. Since March, care workers have been barred from bringing their spouses and children, also known as dependents, with them to the UK, which the sector said is putting people off from coming to the country. A senior Home Office source told the government would not be relaxing rules around health and care visas and would continue with tougher controls introduced by the Conservatives in their immigration crackdown. "We're not looking at it again, we're continuing the restrictions," they said. Nadra Ahmed, chair of the National Care Association, a trade body, told a fall in overseas staff was contributing to a staffing shortage that is affecting people who desperately need care and support. The sector has about 130,000 vacancies. She said about 70,000 people who work in care homes were recruited internationally. "They are making a huge contribution to our ability to have the capacity to deliver care," she told "It's extremely worrying that we've got decreasing numbers of people who want to come to the UK to support our sector. The rules about dependents have had a huge impact as well." She added, "Social homes have already closed and they said it's because they couldn't get the workforce." Ms. Ahmed said she was worried more homes would shut because of the visa changes, saying there are not enough Britons who want to work in the sector and meet the growing demand for care from an aging population. She said it is common for care home staff to be paid minimum wage because of limited funding from local authorities, which pay for social care using a combination of funding sources including central government grants and council tax. "We'd love to pay them more but local authorities' funding is woefully inadequate," she said. Raj Sehgal, who runs Armscare, a group of 5 care homes with 148 beds around Kings Lynn, West Norfolk, said the visa changes have led to a noticeable decline in applicants from outside the UK. "We don't receive that many applications anymore from people overseas," he said. "It's primarily those that are looking to either switch jobs now, or those migrants that are not getting the hours that they need in their current employment. Because they're already in the UK, it's a lot easier to switch jobs." About half of his staff are migrant workers. He said they really struggled to find staff until they started hiring from abroad. Many of his staff members have come from India and African countries. In 2022, the Conservative government relaxed visa restrictions affecting care workers, which made it easier for operators like Mr. Sehgal to fill vacancies. Without migrant workers, he said occupancy levels had plunged to only 67% of beds, and are now at 93%. That was at a time when the hospitals were crying out to discharge people, he said. "We have job vacancies, as we do all the time in the care sector, as everybody does really, and we advertise them," he said. "To be quite honest, we do not get a single local application come through. If we do get any domestic candidates, generally, they either don't show for interview, don't respond any further or, in the last 3 cases, they've lasted probably about 72 hours before going off sick. We just don't get the people coming through." He said the government does not fund social care enough to allow care homes to pay more than minimum wage, which means Britons would rather get the same pay stacking shelves at a supermarket. Mr. Sehgal said he has often employed the spouses of his overseas workers, who also pay taxes and contribute to the economy. "They don't come here to sit on their backsides and think, 'Oh, what benefits can I claim?'" he said. They can't claim any benefits. One of his workers asked if he might be able to find work for her husband, who was deaf, and he now works at the care home cleaning and in the kitchen. Mr. Sehgal, 58, believes it is wrong for the UK to expect people to migrate here for several years and be unable to see their families. "This is a tsunami waiting to happen," he said. The growing need for care in this country is on an exponential trajectory. More and more people are needing a more complex level of care every day. At the same time, we've got less people willing to look after those people. Something has to give. A Home Office spokesperson said, "Today's statistics show there is still a long way to go to reduce historically high levels of legal migration. Immigration brings many benefits to the UK, but it must be controlled and managed so the system is fair." Work is already underway across government to tackle the root causes behind high international recruitment, which is still driving up numbers of overseas workers on the skilled worker visa. By linking immigration, labor market, and skills systems, we will ensure we train up our domestic workforce and address this shortage of skills.